is very important as we speak often on reforms. But reforms are not automatic. Reform come with key data. And one of the issues that St. Martin had is that we have not acquired accurate, up-to-date data. In order to make good reforms, sufficient reforms, we need to understand the dynamics of our country. I am happy that we were able to have assistance by the TWO, but I would also say with the same breath to the team, to the government of St. Martin, this is your project. This is your findings. These are things I have boldly said on the floor of Parliament. We knew what needed to be done. We have assistance to get it done, but these are our projects. Remember that. We often say country package, country package, country package, but these are our projects. Thank you.
When we have scholarships, we don't have scholarships for gerontology or geriatric care services. As a result, you have to go away when you study that. And when you look at the market, there is a great need for those services. So Mona Jamaica, UE Mona in Jamaica, now has a postgrad diploma course in a degree, diploma in gerontology and geriatric at the level of postgrad and master's and PhD. And that is a big one, and that's a plus. And I spoke with two graduates from it, and they were very impressed with it, and it is going to be recognized. So here, we really have a demand, and this migration is like a brain drain that we still have. And then this is a big one, because I did a presentation for private sector recently. As a matter of fact, they asked for it because they are looking at the silver economy. They did it like a pie chart, all the different parts that make up now this economy. And silver now is to be represented because of the numbers. Because if you did a sort of trajectory where you saw Trinidad and Tobago would now be 17.1% by 2025, it means we are roughly about 15% of our population. So it has to be flagged. And what private sector is looking at is giving them that snapshot, and they recognize now they have to invest because they are going to invest for profit. Retirement communities and or assisted living facilities. And what that package comes with, because the Chamber of Commerce, which is the umbrella body for quite a number of the private sector organizations in the Caribbean, you will get quite a number of them, they are looking at the fact that it's not just about building structures of the assisted living facilities and retirement communities. What those facilities would then generate, and this is for the younger ones in the audience, those will generate niche markets, because those would require services that are not yet here. And we're looking at diet for the nonagenarians, for seniors. You have a whole market. Just how you would do event planning for marriages, now you have event planning for funerals. You also have event planning for entertainment and culture for seniors. We did it when we were at the Division of Aging, and you would be amazed at the different technicalities that you have to go through when you have to choose a venue and all these different things. Now that is a niche where somebody can do that as a profession. And don't look at it slightly, because these seniors that are existing are not dying in a hurry. You have different cohorts of them, and this is just for the policy planners and developers. The 60 to 74 are your young old. Your 75 to 84 are your old. And your 85 and over are your oldest old. Those are just social constructs for the minister and the staff and the public servants to understand and be able to project which which is the cohort that will need more assistive devices and be more infirm, and as a result more dependent on the state, and that would be the oldest role.
The pension system currently is a three-pillar system. The first one is a state pension that everyone that is a resident of, in this case, St. Martin, gets when they reach the retirement age. Then we have the second pillar, which usually is provided by the employer. So the employee and the employer, they pay contributions to get to a certain additional pension on top of the state pension. And then you have the third pillar pension, which is a voluntary private pension. In most countries, or at least in Curacao and in St. Martin as well, there are tax deductibles for the premium. There are certain requirements to do this, but yes, it's voluntary, but it's kind of supported by the government. If we look at the financing of the first pillar, which is the reason I said that Dr. Rao's presentation is very important for us. It's in the first pillar, we all, as the workforce, are paying contributions and premiums into the system that's used directly to pay the current pensioners. So the important thing in this is we should be getting enough money from our workforce to be able to pay these pensions. The second pillar is what we call capital funding. Capital funding is that the employer and the employee pay contributions, and this is directly for the employee's pension. And either a pension fund or insurance company, whichever the employer chooses, is handling these pensions and investing these contributions to get returns, which are in turn added to the pension of the employee. And then the third pillar is, as I said before, is totally individual. So each person can have an annuity insurance, for example, that will pay a certain fixed income after retirement each year, and they pay a premium for this, or a premium annually, or it can be a single premium. I want to discuss the first and second pillar in more detail, and also I will try to show you what challenges we see in these areas. Actually, the first pillar is built up quite simple. The retirement age in St. Martin currently is 65. Everyone that's insured is are either residents of St. Martin between the age of 15 and 65. There are also non-residents that could be employed in St. Martin and pay taxes in St. Martin, so they also pay contribution into the system. So they are also considered insured for these, for the first pillar pension. And there are also non-residents. What you see often in other countries, these are people working for example, embassies, that they are still employed by the country. They don't live there, but they pay taxes. They get their salary from the country. So in this case, this third group would also be part of the insured in this pillar. Currently, the ALVE pension amount in St. Martin is $1,038 in 2023. And the accrual of a full entitlement is that you should be living in St. Martin from the age of 15 until 65. If there is a certain period where you did not live in St. Martin and are not considered being part of the third group, then you would have a discount. So you wouldn't receive the full amount of $138 in that case. If we look at the financing of this pillar, this is specifically the case in St. Martin in 2022. So the contribution is in total 13% of the salary of each employee, and it's paid partly by the employer, and 7% and 6% by the employee. There is a maximum salary for which so if the salary is above this amount, 117,000, no contribution is paid for that amount above that part. So, and in some, for example, the case I know best, for example, in Curacao, you still pay 1%. It's very low, but they still make people pay a certain contribution above this wage maximum. So it's not entirely 0% in some places. On the next slide, because we looked previously at the amount that's paid monthly for a single person, in a retired single person in St. Martin. If we look at this, would we say this is enough? Is it a good level? That's a discussion that's constantly happening also about, is the minimum wage enough? So on the next slide, I tried to put a comparison. It's very busy, but I will explain it a little bit. The green columns are just the Alvea amounts on each island. If we see, for example, Curacao, if you just look at the amounts, you would be like, is it possible to live from that? No. But then next to it, I put the minimum wage, which is in blue, the current minimum wages in 2023. And what I want to show with this is that if most of our pension system, most parts of it, are derived from the Dutch system, at least the old Dutch system, because I will come back to the part where there were some changes to the pension system in the Netherlands. But if we look at this, usually in Holland, the AOW pension is 70% of the minimum wage. So if we look at the cases of the 6 islands, we see that 4 islands are in line or even higher than 70% when it comes to the AOW amount. But if we look at Curacao and Aruba, it's slightly lower. Aruba is a little bit less than 70%, and Curacao is even less than 50%, so that's very low. And what I wanted to show, I couldn't find information reliable for Curacao and St. Martin. What I wanted to show is this really a good amount to live from? Like, if you have an only AOW or you are living from a minimum wage, is this enough? So if we look at the cost of living on the islands, I could find information. It's basically telling us that this is not enough.